You know, get the real deal. Please join me in welcoming our keynote speaker, Janice Mathis.
Good morning. Well, you've heard the speech. I can't do any better than that. I bring you greetings on behalf of the National Council of Negro Women. We're headquartered in Washington, D.C. Dr. Thelma T. Daly is our president, and it's a privilege for me to address NCICP. It has been beyond my expectations. I had read about who you are, I met L.J. Tan, but I had no idea that I would learn so much, engage so deeply, or be challenged so thoroughly as I've been in these past 3 days. It has been a joy. Give yourselves a round of applause. I want to try to answer, what is Good Health Wins? You've heard, you've seen the work, you've seen the volunteers, you've had a chance to get a sample of who we are, and I hope that you've met somebody. How many of you met somebody that you didn't know before who was part of Good Health Wins? That's really what it's all about, because when we make these connections, we can go back to our communities and make a difference. And I think that's why I came, and I'm sure that's the reason that you're here. But what we wanted to do was rally our existing network. We knew that the way NCNW was built, with the affiliates, with the sections all over the country, with these deep ties to history, that we had the potential to be a real force in health equity. But it was a little bit underutilized. So when this young lady came to see me, she hunted me down. Y'all wouldn't believe. I was speaking someplace, I think it was in Wisconsin. She wasn't even supposed to be there. She found out I was speaking and said, I came to see you because I have something that NCNW needs to do. I had to listen. And when I heard what the project was, that there was an opportunity to engage more deeply around health equity, I had to say yes. And so we set off to work. But to be honest, NCNW had a bit of a head start. We have a long history of working to ease health disparities in communities of color. Way back in the bad old days when HIV and AIDS was a death sentence. I'm old enough to remember that if you contracted it, you died. There were no therapies, there were no strategies to ameliorate the disease. NCNW was one of the first organizations to deploy to HBCU campuses all over the country to teach young people about safer sex, to hand out condoms. And you can imagine, in our very devout communities, it was controversial. But our leader at the time was a wonderful woman named Dr. Dorothy Irene Height. If you've never heard of her, some of you have. Please Google her. She was on the mall the day that Martin Luther King gave the famous speech about having a dream. She was not allowed to speak because she was a girl and all the speakers had to be men. But what she did do in the basement of the Lincoln Memorial was encourage them to allow a very young John Lewis to speak. And when they tried to say, well, he's not old enough and he's not this, she said, but he will speak. And she gave him the spot that she could have occupied. So that's the kind of leadership we have: bold, courageous, forthright, forward-thinking leadership. I want to acknowledge the delegation that is here today, starting with Mrs. Moss. You've seen her in action. I don't need to put anything else with it. You know how capable she is. Our network of affiliates and NPHC members know how she can get you to do things you didn't think you were capable of doing. And do it with that smile, and so gracious and so kind. We're so grateful for you, Zenobia. Please give Zenobia Moss a hand. I want to acknowledge our National Panhellenic Council partners. I know you've seen them before, but if you're representing one of the 9 Panhellenic organizations, please stand just briefly and remain standing. NCNW has is that we were built to last. Mary McLeod Bethune received a statue in Statuary Hall this year representing the state of Florida, replacing a Confederate general as the Florida state representative. And her vision was to have a voice that spoke on behalf of all Black women, their families, and communities. And so she devised this plan to affiliate. So there are 32 affiliates. Now, the CDC money covers about 10 of them. And so I got, I'm like the old lady who lives in the shoe. I got so many children, I don't know what to do with those who are, and they regularly ask me, when are we going to be part of Good Health Wins? But we're working on that, and we're going to get it together. But if you're a representative of one of our affiliates, Top Ladies of Distinction, the Continental Societies, the National Black Nurses Association, Chi Eta Phi, Swing Phi Swing, or Les Gems, please stand at this point. Organizations. So if you're here representing Texas or North Carolina or Florida, Ohio, Pennsylvania, Virginia, Maryland, Georgia, South Carolina, Alabama, or New York, please stand. And so now you get a sense of that we're layered. We're not vertical, we're vertical and horizontal, which gives us strength. If we were a building, we would be indestructible, which is why 87 years later, we're still here, still doing God's work. Thank you. Please be seated. Now, I talked a little bit about NCNW, which is one of my favorite things to talk about. I want to talk about Immunization Coalitions. Will you indulge me for a moment? LJ Tan, I will confess to you, I did not know what an Immunization Coalition was. Had never heard of such a thing. Had no idea. I asked Ms. Moss if I asked her one time, I asked her a dozen times, because she had experience. What is an Immunization Coalition? How are they funded? What do they do? Where do they come from? Who do they report to? How are they authorized? What is their mission? And I still, it still didn't click until she arranged a meeting with LJ Tan. And that the light bulb started to come on. And I realized that not only could we do this work, but there was a clear and welcoming path to involve NCNW and Good Health Wins. And to tell you the truth, I was disappointed in myself for not knowing. Synovia let slip about Duke. I did study health policy at Duke University as an undergraduate. I was on the board of the United Way of Northeast Georgia. I was on the board of a nurses' clinic for the homeless that some really committed nurses in Athens established. I was on the OIC board, and all of that community service, the community foundation. I'm this community organizer, right? I'm 25 years old, I can run the town. That's a good thing for me to be doing. And I should have known, but I did not know. And I fought myself, and I think, no wonder this health equity work is so difficult. We had a campaign one time, 9 by 90. By 1990, we wanted to reduce the infant mortality rate to 9 per 1,000 births. That was our goal. Back in those days, I had no idea that there was an Immunization Coalition. It just proves I'm Exhibit A for the proposition that you can be deeply involved in community and not know the thing that you need to know most. We had just gotten our first federally qualified health center. I love FQHC, love them. 2 of the most committed Black female doctors I've ever known worked there, and they were just about my age too. And so you can see, but then you don't see the whole picture, and that's one of the reasons I'm so glad to be here. I also want to talk a little bit about confidence. I see on the sign, fostering equity, building partnerships, and vaccine confidence. But you can't build confidence in a vacuum, because confidence is a two-way street. If I'm going to have confidence in a provider, that means I have confidence in the people designing, manufacturing, administering, and promoting the vaccine. Confidence is something you have in people, not in things. Confidence is a human emotion. You don't find it in test tubes and syringes. And as advocates, we have to have confidence in the people that we're advocating for, confident that they deserve the help, confident that they are looking out for their own best interests, confident that they're not self-destructive. We have to have some confidence in them as we expect them to have confidence in us. One of the first things that we did is we started to gear up Good Health Wins, depending heavily on the leadership of our very, very able and astute Chief Operating Officer, Crystal Ramsua. She took us on a journey of discovery and a strategic planning activity, not an activity because it lasted a whole year. Who is the Black woman? And so part of that was that we did a survey of about 4,000 Black women. And what we found that because we were surveying our membership, a little bit more affluent, a little bit better educated, a little bit older than the average Black woman. But even among that group that was not hesitant at all about flu vaccines or COVID vaccines, they said, give me my shot, I'm ready. Even among that group, 10% of them felt that their doctors did not care about them, did not hear them, did not understand them, and did not appreciate them. That was eye-opening. And so, even though it was just a mirror image of our membership, we realized that we had work to do. We see every day in the news that the global economy is precarious. And this goes back to that question of confidence. You know, one of the reasons that there's a shortage of everything from computer chips to chicken wings is that the people who bore the brunt of the pandemic are the people who make those things that are necessary to us that we don't think about often. I had kind of rather severe survivor's guilt. On March 13, 2020, we walked out of our beautiful office on Pennsylvania Avenue, and we really haven't gone back yet. So I set up a little room in my house, bedroom, and there was a window that looked out on the street. And I could see the pizza guy come several times a week. And I could see the garbage guy come every Thursday. And I could see the mailman come every afternoon. And I thought, but for the grace of God and two very committed parents, I could have one of those jobs where I wouldn't have the luxury of being in my spare bedroom in my PJs on Zoom. And it was a start, it was a constant reminder to me why health equity was important and why it was important that I be involved in it, because nobody chose what their role would be in the pandemic, but it affected all of us. But here's the good news. We are working together to expand, reinforcing trusted networks, training trusted messengers. NCNW is a membership organization. We exist primarily to serve our members, but in serving our members, our mission is to lead, advocate for, and empower women of African descent, their families, and their communities. So that's everybody in here. That's everybody at home. That's everybody in our workplace. It's important, I think, to acknowledge that over the course of the vaccine rollout for COVID, the differences between vaccination rates, some of the disparities began slowly to dissipate. You know, in the beginning, back in April 21, let's say, when the vaccines were beginning to roll out, you know better than I do, that the gap was about 14 percentage points between black and white uptake. But by July of 2022, it was down to a 5% gap. Now, where you had 59% of black folk vaccinated against 64% of white people overall having had at least one shot. That's a remarkable achievement. So as you think about your work, and I know it can be discouraged, I sat listening this morning as you talked about strategies to counteract internet disinformation. And it is a powerful force that we're all up against. Don't be discouraged. I listened to the doctor earlier this week talk about what burnout looks like, how you can be discouraged, you feel despondent, you feel that what you do doesn't matter. I'm here today to tell you to be encouraged, because you are making a difference. And numbers like that tell the story. Part of our story is that from June to August of 2021, Good Health Wins campaigns reached 804,000 people. and 217,000 attended at least one Good Health Wins event. Our messages reached 2.6 million people. And this level of participation continues. We launched Get the Facts, Boost the Truth. How many of you, by show of hands, had something to do with Get the Facts, Boost the Truth? It was a multimedia campaign on radio, television, internet, and TikTok. And of course, TikTok outperformed all the other platforms. And the theme of Get the Facts, Boost the Truth, and I really owe it to my young colleagues, Candace, where are you, Candace? And Ajua and Jade, they brought, I would never have known who Brother Islam was, because I'm not in that corner of the internet. Tall, charismatic, well-dressed, handsome, and ignorant. But they were enamored of him, as if I was 30 years younger, I would have been enamored of him perhaps. Because he was just spouting this stuff. Eventually, he was banned from Facebook as one of the 13 dirty dozen purveyors of disinformation on the internet. I didn't want to incite him and his followers by going after him by name, but we designed a campaign, Get the Facts, Boost the Truth, to go after his message. And the message was, if you take the vaccine, you'll never have children, your children will be stillborn, you'll be infertile, blah, 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 blah. We employed Dr. Jackie. Y'all don't watch Married to Medicine, do you? We got Dr. Jackie, who is OBGYN specialist, but she's also on this terrible reality show based in Atlanta. But popular, you know, well-dressed and utterly inappropriate. But she did a good job for us with the campaign. And we also added Dr. Valerie Montgomery Rice from Morehouse School of Medicine to speak to our folk about what is the truth about vaccines, what do we really know about fertility and the COVID vaccines. That campaign was very successful. We learned an important lesson, though, about how skepticism grows. There is a well-documented disparity about maternal morbidity in the Black community that is not related to socioeconomic status. You can be a C-suite denizen and still have trouble with childbirth if you are a Black woman. And we don't really know what all that is about. Is it stress? Is it diet? What is it? But if you take that thing that is real, you know, they say every lie has a little bit of truth in it to make it believable. If you know that there is this problem with maternal health in the Black community, and then you sprinkle that with enough propaganda, it's not surprising that people will start to believe it. This is true. This person looks credible, so therefore their conclusion must also be true. That was an important lesson for us to learn. I had over the Labor Day weekend, a friend came to visit. Somebody I've known for a long time, since she was a very young woman, a student. She was doing contact tracing for a large health department in the South. Energetic, well-educated, somebody I wouldn't have thought would be a conspiracist. But she started telling me how she came away from her experience convinced that her coworkers were not sufficiently concerned about achieving good outcomes. She complained that she was criticized for working too hard, for trying to create a standard operating procedure and other perceived slights. She jumped from that experience, which might have been burnout from the way she described it to me. Colleagues might have not so much. She jumped from that to, they're giving us something to make us have fibroids. Now that's a leap. And I had to be patient and quiet and listen for a while to see how can I approach. I said, well, you know, fibroids, a lot of things can cause fibroids. And then how would you keep that a secret if that was a conspiracy? That would be a big secret to keep. But it's just an example of how pernicious and how difficult to deal with this internet and these experiences that we have. But we listen closely. Give you a couple of examples of some things that did work for us, and then we'll be done. Who is California? Is Helena still here? She had to get a flight. Helena Johnson, our state president from California, Californians in the house, did something they call baby talk. And one of the most compelling aspects of it was a woman who was a nurse. And she was not taking the vaccine, and she was not taking advice about the vaccine. She had made up her mind that it was not for her. But in this video, in this Zoom, she talked about her journey from hesitance and skepticism to confidence in vaccination. She talked about how she read as much as she could from many sources. She talked to family and friends. Don't underestimate. Ms. Moss, keep working on your brother. I got some people in my family I'm still working on too. She talked to her fiance. And eventually, gradually, over months, she made that journey. So if somebody doesn't hear you the first time, don't give up. Maybe it'll be the next time. I know this is not a religious event, but somewhere in the Bible it says we plant the seeds, but we're not responsible for the crop. So our message today is that we must continue to plant those seeds of truth and optimism, and don't worry about what the increase. God will take care of the increase. And one of the things she learned was that black folk were part of the trial. So those of you who are scientists and who advise scientists and medical researchers, having trials that look like the community that the medicines are intended for is very, very, very important. You've already heard about the vaccine clinics, the going door to door, the webinars, the county fairs. I continue to be amazed about the number and variety of events, campaigns, and projects. And thankfully, we realized early on that we needed to be able to measure our impact. Jay Walker is our very able data scientist. We're so glad to have her in our midst. She keeps us on point. Ultimately, our goal is to achieve a greater degree of health equity. And so what does that look like? You know, more than 50 years ago, y'all always say I talk about Greenville. I talk about Greenville because Greenville is an interesting place. There were no black pediatricians in Greenville, South Carolina in 1965. But my mother was an ambitious and diligent woman. And so she found Dr. Jean. Dr. Jean had a nice office with a lot of toys in it, and he had fish in the aquarium, and he smoked a fragrant pipe, and he was always clean and smelled like shaving lotion. That's what I remember about that. And I had allergies, so they'd take me and prick my back, you know, to see what I was allergic to, at least once a month. And as I got older and I thought about his nurse was Nurse Morgan. Nurse Morgan wrote me notes and birthday cards until I was well past the age of having a pediatrician. And you probably guessed by now Dr. Jean was white. And I thought about Dr. Jean, how courageous he must have been in Greenville, South Carolina at that time to treat a black family and to treat them with dignity and respect. That gives me hope. That lets me know that we're capable of doing what we think is impossible. So many times we talk about the social determinants of health. Income, education, comorbidities, environmental threats, neighborhood crowding. I submit to you that there is another, less discussed social determinant, and I've hinted at it already, hope. When hope is in short supply, the value of life declines. When hope is abundant, pessimism and resentment fade. When hope is absent, bitterness grows. I grew up in a decidedly working class neighborhood in the 60s. There were no large homes, overseas vacations, big diamond rings, or luxury cars. There were no dishwashers unless you count me and my sister. Clothes were hung outside on a line to dry. There was no dryer. There was church every Sunday, and virtually all the families were intact. We had few material goods, but we had hope. And that hope was built on that we could improve our circumstance through education, diligence, and responsible living. But here's the thing. Despair's cousin is hopelessness. And hopelessness is a dangerous, self-fulfilling prophecy that we in this room cannot afford to give in to. I don't care if the anti-vaxxers, they disrupted a couple of our Zooms. You know, I don't care if the anti-vaxxers are after you. Now, I'm not with all that coming to your house and picketing your home. Call the police. I'm not that much of a civil rights advocate. And so, but the antidote to despair, the antidote to a lot of what we see is hope. And so collectively, we can't just be in the business of distributing vaccines or developing them or testing them or fighting hesitancy. We've got to be in the mission to cultivate hope and truth. I get the feeling today that too many people, black, white, Asian, Hispanic, don't have that hope, don't have that belief in the American dream anymore. Hope gives you the resilience to face life's adversities. Hope gives you the strength to hold your mother's hand as she takes her last breath and know that life will go on. That's our challenge, whether it's on an indigenous reservation, a Rust Belt Middle West town, an urban public housing complex, or a working class southern neighborhood. Our job as community organizers and advocates for marginalized groups is to move toward restoring hope. Our knowledge is useless if we can't share it to help people make their own lives better. The future of health equity can be better than the past if we work together. There was a guy at the University of Georgia named J.W. Fanning who was sort of a pioneer in leadership. You know, we have leadership everything now, leadership Chamber of Commerce, leadership Georgia, leadership Atlanta. He was one of the pioneers, and he said something often that stuck with me. He said the best leaders leave the people saying, we made progress and we did it ourselves. We have to inspire confidence in our people so that they will do what they need to do to protect their own health, whether or not there are circumstances that limit them. The pursuit of health equity, I believe, requires that we reach beyond our comfort zones to build genuine understanding. So many times during these last couple of years, I've thought about Dr. King and wish that he was still here. Injustice anywhere is a threat to justice everywhere. My own father put it more succinctly. He was a football coach whose only 2 children were girls. And he was good enough not to ever act disappointed. But he was fond of saying, don't get in the give up formation. Get in the shotgun, get in the eye, get in any kind of form, but don't get in the give up mode. And I guess that's what I'm here to say today. Because infectious diseases know no boundaries, do they? China's problem today is Europe's problem tomorrow, and the United States' problem next week. Dr. King said we are caught in an inescapable network of mutuality, tied up in a single garment of destiny. Whatever affects one directly affects all indirectly. The fate of one is the fate of all. My health is tied to your health. I can't be any healthier than my community is. None of us are free until all of us are free. We're not just fighting skepticism or hesitancy. We're fighting despair. We're raising hope. I leave you with the words of our founder, Dr. Mary McLeod Bethune. Be calm, be steadfast, be courageous in this work. God bless you and keep you.